we delve into it? Why don't we delve into, I think just in general, there's differences between how we as veterinarian professionals approach situations versus the human profession. And I'm going to be a little controversial here, because there are those that really feel that the human medical world can actually learn a lot about veterinarians and how we deal with things, not only from communication standards, but, end of life and, passing and hospice care and everything like that. So I just wanted to get your thoughts on how it's like a team effort. So you have your team, the pet parent, and the patient, and you're dealing with a case versus how, and I don't want to criticize your care. I'm sure the care that you received was excellent, but it seemed like there was a lot of alone, and that your camaraderie came through speaking with the other patients there, or if Mike had joined you there beside you, your husband, right? That's the sense I got, as versus when a pet's getting their chemo, that they're being snuggled by one tech, right? You're there and the whole team's there. And to me, it creates a completely different environment. I wanted your take on that.
Yeah, well, we actually had one, is a really overweight, darling, like 3 or 4 year old female bulldog named Amy. And I don't know if you remember that song on the radio. I'm not going to completely, it was like maybe like a 60s or 70s type folk, Amy, what you're gonna do? Do you remember that?
Oh yeah, okay,
so
yeah.
We would literally sing that song in the back, and I remember, again, her father was very stoic, and I one time told him this, and he was just silent. I think he thought we were crazy. But the bulldog would wag its stubby little tail and its rear end, and she would be all excited because we were singing her little happy song. I too will be controversial. I commend the human profession. They are in certain aspects leaps and bounds, further from us in terms of knowledge and technology. And thank God, I got the best of care. Like, I cannot say enough good about it, but there are some things, that they could learn from us, just like we learned from them. And, I was one time euthanizing a family's Labrador, and it had actually lived for 7 years with metastatic cancer. It was
wow.
It just beat the odds. It did great.
Yeah.
And the father is a pediatrician, and his son was just in his senior year of medical school, and the mother was there. And at the end of it, their son said to me, actually, no, it was after they went home, and we had sent them flowers, and the family had called the next day, and they said that their son had said, I learned more about compassion in that, 30-minute endeavor, with Dr. A, than I have learned in my 4 years of medical school.
Wow.
And so I think sometimes we as veterinarians, or just as veterinary medicine in general, the technical staff, nursing, we just maybe bring a bit more, as a whole, compassionate view. I think too, sometimes, just my opinion, of course, that human medicine has become so specialized that they lose sight of the whole patient. Whereas as veterinarians, even if, I'm just doing oncology or my husband's just doing ophthalmology, we still treat that whole patient. And I think we, at least as an oncologist, I get to know that family because we're treating that entire family dynamic, not just the signs and symptoms of the disease. One of the things that bothered me is when I asked any of my doctors, radiation oncologist, medical oncologist, surgeon, nobody was willing to tell me what the odds were. Whereas in veterinary medicine, you bring your dog to me, I can tell you the % chance that he goes into remission, and I can tell you based on months or days or, weeks or years, what those odds are of reaching those numbers. And I understand from the human profession, they said it doesn't matter what the masses do. If you're that 10% who is very unfortunate, if you're that 20% who hits it out of the park, it really doesn't matter because it's just you. And I get that. I think though, for me as type A and, kind of a scientist, I wanted to know because I wanted to know what the benchmark was so that I could do better. But I also get that if they had said, oh my goodness, there's a, big chance that people with this don't do well, that might have just brought me down, and certainly they don't want that.
Yeah, it's interesting because I was wondering if a lot of this actually has to do with liability concerns they have.
I'm sure, right? Probably that some.
We don't really deal with, right? It's right. Like every time I get the silent type treatment, and I agree with you. I get that on my end as well from the human profession. I always wonder, is there some form of liability concern that they have? And then it becomes detrimental for care, right? Patient care, right?
Correct.
And the other thing that made me think when you're talking about chances, I always think about like the Star Trek episodes. We have a 2% chance of this being successful, and it works, right? It works in the day.
Exactly.
So beat the odds. No, but you're absolutely right. And when I do tell clients about seeing oncologists, I say they're going to tell you exactly what the percentages are based on what you decide to do. And it's like, it's interesting, right? Because that's one of the first questions these people want to know, right? What are the chances? Because I need to know, whether it's personal, financial, whatever. I need to know. So that's an excellent answer. I
think medical insurance, right, that people have, right, that also handcuffs a lot of physicians. Whereas we are so fortunate right now, and hopefully we won't ever have to deal with it that way, right, to have a third party payer for us, because we don't have those limitations. We don't, and I think it's much better medicine. It's a much freer atmosphere if we don't have that.
Oh, and way more communicative, because it's like if a third party is dictating where you go for the next steps, and I'm your GP and I don't know who that person is, how can I guide, right? To me, it's always about, and that's the other thing I love about vet medicine is I always say we're 1 degree of separation from every vet in the world. It's like, I know you through Mike, right? We pass across that animal. I think everyone is familiar to me. So it's like, even if I really don't personally know a specialist that I refer, I kind of know them, right? You know what I mean? It's like, or know of them, or I can find out really quickly, right? By making a phone call or text, right? So it's one of those things that I think is fortunate about the vet profession. Yeah. And I think that's an area. I think communication is huge, and it's not there. It's like until the invention of these portals for my own medical health, I'm really not getting answers or looking at things unless I go into my own portal and go, so, I'm being a vet, I'm looking at my blood. Oh, okay. Oh, okay. What's this, right? That's what we do, right? It's our nature. It's our inquisitive nature, as veterinarians do.